Before we begin, this video is for general educational purposes only. It isn't medical advice, and anyone with concerns about symptoms or possible exposure should speak with a qualified healthcare professional. Cyclosporiasis may sound like a newly discovered disease, but its documented history goes back nearly 50 years. The illness was first reported in 1979 after researchers found a previously unidentified parasite in people in Papua New Guinea. For years, scientists weren't completely sure what they were looking at. The organism was sometimes mistaken for other parasites, or even described as a cyanobacteria-like body. It wasn't formally identified and named Cyclospora cayetanensis until 1994. Then, in 1996, Cyclospora became a major food safety concern in North America. More than 1,400 cases were recorded across the United States and Canada in an outbreak linked mainly to fresh raspberries imported from Guatemala. That outbreak demonstrated how a microscopic parasite normally associated with contaminated food, water, and international travel could cross borders through fresh produce. Other large outbreaks followed. In 2013, 631 outbreak-associated cases were reported across 25 states and New York City. Investigators determined that multiple outbreaks were occurring, including illnesses linked to imported cilantro and a bag salad mix. In 2018, an outbreak connected to packaged vegetable trays caused 250 confirmed illnesses, while another linked to salads sold by a fast food chain caused 511. In 2020, bag salads were connected to 701 illnesses across 14 states. So, while many Americans are only now becoming familiar with Cyclospora, public health agencies have been investigating produce-related outbreaks for decades. So, what exactly is cyclosporiasis? It's an intestinal infection caused by Cyclospora cayetanensis, a one-celled parasite that's too small to see without a microscope. Humans are the only confirmed host known to complete its life cycle. The parasite is more common in tropical and subtropical regions, but it can appear anywhere when contaminated food or water enters the supply chain. An infected person passes immature forms of the parasite, called oocysts, in feces. But those oocysts aren't immediately able to infect someone else. They normally need at least 1 to 2 weeks in the environment to mature. That's why cyclospora usually doesn't spread directly from one person to another like a typical stomach virus. Instead, human waste contaminates food or water, the parasite matures outside the body, and another person becomes infected after swallowing it. Yeah, gross. I know. In the United States, outbreaks have been associated with fresh produce, including raspberries, cilantro, basil, snow peas, mesclun lettuce, vegetable trays, and bagged salads. Fresh produce presents a special challenge because it's frequently eaten raw. Washing can reduce contamination, but it can't guarantee that every cyclospora organism has been removed, especially from leafy greens or fruit with rough, creviced surfaces. Once swallowed, cyclospora infects the small intestine. Symptoms usually begin about 1 week later, although they can appear anywhere from 2 days to 2 weeks or more after exposure. The most recognizable symptom is frequent watery diarrhea, which the CDC says can sometimes involve explosive bowel movements. Other symptoms include stomach cramps, bloating, increased gas, nausea, appetite loss, weight loss, and significant fatigue. Some people also experience vomiting, body aches, headaches, or low-grade fever. One reason cyclosporiasis can be difficult to recognize is that it may not behave like a normal, short-lived stomach bug. Without treatment, symptoms can continue for weeks or longer. They may improve and then return, sometimes more than once. Fatigue may also continue after the intestinal symptoms have eased. Diagnosis can be difficult too. Routine stool testing doesn't always include cyclospora, and an infected person may not release enough of the parasite in every sample for it to be detected. Laboratories may need special staining, ultraviolet microscopy, or a PCR test that looks for the parasite's DNA. In some cases, several stool samples collected on different days are required. The standard treatment is the prescription antibiotic combination trimethoprim sulfamethoxazole, usually shortened to TMPSMX, and sold under names including Bactrim and Septra. The CDC lists 7 to 10 days as the typical course for otherwise healthy patients, although actual treatment decisions depend on the individual. The CDC also says that no highly effective alternative has been identified for people who cannot take TMP SMX. That can make treatment more complicated for people with certain drug allergies or medical conditions. Most healthy people eventually recover, and cyclosporiasis usually isn't life-threatening, but that doesn't make it harmless. Prolonged diarrhea can cause serious dehydration and lead to hospitalization. Reported complications include malabsorption, meaning the intestine doesn't properly absorb nutrients, inflammation of the gallbladder, known as cholecystitis, and reactive arthritis, in which joint inflammation develops after an infection. People with weakened immune systems may experience more severe or longer-lasting illness. Death appears to be rare, and none have been reported in the current U.S. outbreak, but hundreds of people have required hospital care. Now to the current situation. As of July 13th, 2026, the CDC had received reports of 1,645 laboratory-confirmed domestically acquired cases in 34 states. At least 141 patients had been hospitalized, and no deaths had been reported. The CDC also said it was aware of more than 5,100 additional reports that still required analysis to determine whether they qualified as domestically acquired cyclosporiasis. For comparison, only 249 cases had been reported nationally during approximately the same period in 2025. Michigan has been hit especially hard. The Michigan Department of Health and Human Services reported 5,002 cases as of July 17th, with 102 hospitalizations reported through July 16th. Most Michigan cases have been concentrated in the southeastern part of the state. The state and federal numbers shouldn't simply be added together. They're updated on different schedules, and reports can be at different stages of confirmation and review. The FDA has specifically warned that state case counts may not match federal figures for those reasons. In state reports compiled on July 10th, New York had reported 470 cases, Ohio 364, and Illinois and Florida each had more than 100. Those figures may have changed, and not all of those illnesses are necessarily connected to the same food source. Federal investigators have identified one major 5-state outbreak involving Indiana, Kentucky, Michigan, Ohio, and West Virginia. The CDC and FDA report more than 1,644 cases involving people who said they'd eaten at Taco Bell, with 94 hospitalizations and no deaths. When Michigan investigators examined detailed meal information from 190 patients who reported eating at Taco Bell, 90% said they'd eaten iceberg lettuce. The FDA supply chain investigation traced the shredded iceberg lettuce to Taylor Farms de Mexico. On July 17th, the company recalled all iceberg lettuce it had sourced from central Mexico. The recall includes lettuce distributed to restaurants, food service businesses, and retailers, including certain market-side iceberg and shredded lettuce packages sold at Walmart. Taylor Fresh Foods distributed recalled products from June 29th through July 16th in 27 states, including Oklahoma. There's one important scientific detail. On July 18th, the FDA reported that a sample of shredded iceberg lettuce supplied by Taylor Farms de Mexico had tested positive for cyclospora. The sample was collected through targeted import surveillance conducted as part of the outbreak investigation. The FDA says the positive product was not part of the company's current recall. The implicated lot was detained, and investigators were working to determine whether any of it had entered commercial distribution or remained in consumers' homes. The positive test provides additional evidence of contamination involving lettuce from the supplier, but it doesn't necessarily prove that the tested lot caused the illnesses. The recall and investigation remain in place because patient interviews, supply chain traceback evidence, and laboratory findings continue to point toward iceberg lettuce supplied by Taylor Farms de Mexico. The CDC has issued a National Health Alert Network advisory to clinicians, laboratories, and public health departments. It's asking clinicians to recognize prolonged or recurring watery diarrhea, request cyclospora specific testing, and report confirmed cases. Public health investigators are interviewing patients about what they ate during the 2 weeks before becoming ill. The FDA is tracing shipments, collecting food samples, working with restaurants and the supplier, and increasing border screening for products connected to the investigation. The most important thing to understand is that this isn't one contagious infection moving directly from person to person across the country. It's a foodborne parasite problem involving a large 5-state outbreak, other suspected clusters, and additional illnesses that haven't yet been connected to a common source. Because symptoms can take about a week to appear, and because federal reporting can lag by several weeks, the totals are expected to continue changing. That is cyclosporiasis. It's an old parasite, a modern food supply problem, and an infection that's rarely fatal, but can be prolonged, severe, and extremely disruptive. This program provides general educational information and isn't medical advice.